I'm Dr. Darren Howarth with Summit to Shore Chiropractic and wanting to go over with a very early phase low back exercise that I would recommend to almost all patients, whether very mild or extremely severe. Depending on how painful this is will determine how fast you can kind of progress through this, but very easy starting point and super helpful with things like disc injuries, sprains, pretty much anything low back. But to get started with this, so what we're going to do is go over a progression, and if any point this gets painful, I want you to move it back a step, or if you're not able to do it, move back a step, or if you can do it just fine and maintain a good position, move forward. Okay? All right, so a few different things here. So starting off, I want you to go into just laying on your back. So pretty simple, just like this. Knees up onto the elevated, just like that. Okay, so first off is breathing. So I want you to be able to, as you breathe, that stomach should be able to move up towards the ceiling. So as you can see, right there. So the belly should come up, the chest shouldn't really move at all. The way that she's doing it right now, it's really good. Want it to be able to be comfortable in that position. This is the type of breathing that you're sitting watching TV, on the computer, just anything really simple. That's where that breathing should come from. Okay, so once you get that started, really easy. The next phase into that would just be really small lifts with the legs. So as you breathe out, lifting the leg just barely like an inch or so off the ground. Okay, so part of this is, can you breathe and move at the same time, as well as can you maintain a good position while you're breathing. So the one thing that you want to look for here is first one, is it painful? It shouldn't be. If it is, again, move back to that breathing, get better at that. Okay? The other part of this is, while you're doing this, I want you to focus on, is one side easier than another? Sometimes you may notice, and especially when it's painful, you may notice when you lift one leg that shoulder will come off the ground. So show that example. So if she's lifting her left leg, typically that right shoulder will start to move. She'll kind of rotate a little bit. So do that for me. So kind of bad. So that would be a bad example, when that shoulder kind of comes off the ground. Okay, good. So next step. So if that feels comfortable, we'll go to the next phase. So now, instead of lifting just barely off the ground, you're going to move that leg out. Straight out, just like that. Okay, and then back up. Perfect. Same thing other side. Again, this is, if it's painful, this is creating a little bit more tension in that abdomen region and into that core. If you can't maintain that good position, you're going to arch in that back. You're going to create more tension in that low back, and it's going to create pain. So again, that should be comfortable, and it's a little bit more difficult than the one before. Good. So next phase would be lifting both legs up off the ground. So hips at 90 degrees, knees at 90 degrees. Already this is creating a lot of core muscle activation, just holding this position. Again, if you're early phases in low back pain, this alone might be painful, so we'd kind of work up to this point. But if you're able to get here, again, maintaining that breathing through that core is extremely important. And now you're just going to take that one leg at a time and touch down to the ground, just like that. And back up, and the other side. So the same thing here. If you can maintain breathing through your stomach and through your belly, and not move up to the chest, because that's a really common concern, is that as soon as you start creating tension in that torso, then you're going to have to breathe through the chest to be able to breathe, and that's just a habit we're trying to get out of. This whole time you're trying to build stability in that low back. Okay? Next step, so far so good, is you're going to take that leg and straighten it out just like that. Okay? And same thing other side. So again, focus on which side is more difficult. This is, each step has been getting harder and harder, and that's on purpose to try and create more tension in that low back. And if you're able to maintain a good position here, all of these should be fairly just easy, a little bit harder than the next one or the one before. And then again, if this is comfortable, next step in this position, arms up toward the ceiling and doing opposite arm and leg. So some of this is coordination. There we go. Perfect. And being able to maintain a nice core position here and moving while being able to breathe. You haven't really mastered an exercise unless you can do it while breathing. So this is going to be an important part, like I said, in that low back rehab. Good. You can relax. So hopefully that makes sense. Like I said, this is something I go over with pretty much all of my low back injury patients. And this isn't necessarily going to fix your problem now and forever, but this is a big one. If you're not doing this well, we need to kind of get that pattern right and get those right muscles firing to where you can comfortably keep moving and progressing, so this doesn't just happen over and over again. Perfect. If you have any questions, feel free to give us a call or email, and stay tuned. Going to keep editing some of these and recording some of these videos for kind of typical exercise routines, what kind of getting started when you're injured and how to kind of keep going in the right direction. And have a good day. We'll see you next time.